Hello, this is Dr. Stanley Lang. Welcome to this broadcast, and the topic is why it's important, why it's critical to reverse diabetes. And the reason I wanted to share this is because of a couple of failures that I have had, that I've experienced with patients in terms of being able to motivate them to become enthusiastic about doing all they can to try to reverse their diabetes. Now, I do share a lot of success stories because I want to communicate to people that it is possible to control and even reverse your diabetes by lifestyle alone. But clearly, everybody doesn't follow that advice. I would say that, maybe 50% of my patients who are diabetic are seriously following the program that I lay out before them, meaning 90+% of the time I think they're following, but a lot of times people don't, at least until they become more aware of the issues. And people know theoretically what the issues are, which are that diabetes essentially speeds up aging of every major organ system, which includes your heart, your brain, your kidneys, your nerves. And people tend to want to do what it takes theoretically, but they find excuses that sort of delay taking action. And so the first patient that I want to tell you about is a very nice fellow, has a deep spiritual life, and so he is well grounded in terms of a lot of the things that I think are important for health, yet that doesn't translate into behaviors that bring health to his body by reversing his diabetes. And in his case, by delaying taking action, he's going to lose part of his foot because of an infection that happened, and it just would not heal because the diabetes had damaged his small arteries so much that that part of the foot just didn't have circulation anymore to be able to bring the ability to fight the infection. So you can have all antibiotics floating around in the bloodstream that you want, but if enough of them can't get delivered to the site of the infection, then there's a big risk of amputation. And of course, we all know that that's one of the big risks of diabetes. And if he had followed what we talked about and what he is now doing, which is following everything to a T, he would not have had this happen to him. And the second person is somebody that was diagnosed at least 3 years ago with mild diabetes, kind of definitely didn't want to do the program that I had because it's a little bit more restrictive than the ADA diet. Decided to go to the diabetic clinic, and then he didn't follow that program either. Sort of dropped off the map. A couple years later, I see him back, and he's got lots more symptoms now. And it turns out that his blood sugar is really super high. He ends up in the hospital. Now he's very serious. Now he's lost a lot of ground. He's lost fitness. He's lost the ability to do a lot of exercise. He has damage to nerves now. He's serious, though, really serious about following the whole program that I laid out before him 2 years ago. Now, what is it about us that stops us from taking action when a clear path is laid before us, and we just choose not to do it? Well, this video is not designed to answer all of that questions. It's designed to ask the question for you to think about. And even if you're not diabetic, you're pre-diabetic, or you're dealing with some other diet-related health issue, what is it in you that's stopping you from taking action when you know what the action is that will make you a lot healthier and allow you to reverse the disease without having to take a lot of medicine? So the question that I asked at the beginning of this video, why is it critical to reverse diabetes? Because if you don't reverse diabetes, if you simply control blood sugars by pressing the blood sugar down with medication, the most serious part of the whole condition continues going on, and that's insulin resistance, which is a very pro-inflammatory state and it keeps cooking your arteries and cooking your nerves. So you might not have these toweringly high blood sugars anymore, but your disease is still progressing unless you reverse the diabetes. Lifestyle is the only way that you're going to reverse diabetes. The strategies that we've laid out, that's the only way that you're going to reverse the probability, the high probabilities of heart disease, of stroke, of kidney failure, of nerve damage, of amputation. The only way you're going to reverse that risk is by reversing your diabetes, not simply settling for control with a bunch of medicine. That's not going to reverse that risk very much. It's going to be better than having real high blood sugars, but it's not going to reverse things the way that in our heart of hearts, we want to reverse that risk. Yet sometimes when we're confronted with the opportunity, we just don't take it because it seems like the cost to our lifestyle is too high. I shared this information with somebody who is literally at a crossroads today. And if she doesn't take action now, this is the last chance she's got. She's got so many things going on that if she doesn't radically change her lifestyle, that's it. She's going to be not long for this world. But she could change it if she chose to. She still could. Now, I don't know your situation, but we're all at a place where we're at crossroads. And if we make the good choice now, we preserve a lot more than if we wait later to make the good choice. So I want to encourage you to make the good choices in terms of low glycemic eating, adequate exercise, having a good spiritual life, a good spiritual health, having good emotional life with good relationships. Do these things now because you can do them now. Don't wait, because waiting only lets more problems creep in that will stop you from living the best life that you can. So I wish you well, God bless, and have a great day.